Hi, I'm Dr. Sylvia Skefich, chiropractor, and today we're going to be looking at and learning the arch exercises for the arches of the feet. This is a really important exercise because the arches of the feet are the foundation that every other joint stacks upon. So if our arches become weak and the foot actually can change its shape and become a flat foot or a dropped arch or a failed arch, all these terms have been used to describe the weak arch phenomena. Even pronation is another term that goes along with the weak arch. When that happens, then a whole cascade of problems can occur, not only in the bones of the foot and the tendons of the ankles and the Achilles, but in a tension pattern that runs up the legs to the knees. Sometimes people have knee problems that are just out of the blue and unexplainable, and it's coming from the feet. So that has to be determined and addressed at the feet if that's the case. Even hip problems, chronic hip problems, can be caused from an arch issue, low back as well, all the way up the body. So we want to improve the strength, the function, the position, the tone of the arches of the feet, and we're going to learn how to do that in this exercise today. So let's get started. So there's two types of support you can do for your feet, for your arches. One we call passive care, and that would be your arch supports or your orthotic device. And it's called passive because you're not doing anything other than putting it into place and wearing it. And then there's active care, and that's what we'll be learning here today, and that's your arch exercise. So what is the significance of strengthening one's arch? Why do we need to do that or put any import there? Well, it's the foundation upon which we stand. And we want our feet to be working properly so that everything else can balance properly and move properly on top of that. Not only to give your feet the best care it needs in and of themselves. So there's a thing called the kinetic chain. The kinetic chain means the chain of motion from joint to joint. So imagine I'm holding a large chain link and I swivel it. It will move freely and easily. But if you weld it together in a link or more than one link, it starts to move clunkily. And not only does it affect that link that's welded, but it'll affect the other ones in the way that it moves. This is the kinetic chain. And they know that if your arches are not working properly, it will affect the muscles going up the leg, creating a tightening usually along this line on the front outside, sometimes along the back side too. That can affect the knees and lead to knee pain. Can affect the hips and lead to hip misalignment, tension along the side, and hip pain. And it's even known clinically to lead to back pain. So if you consider your arch, if this is a side view of your arch, my hand being your foot and the leg coming up off of it, there's a bony bridge of your bones, of your feet. And underneath there's a sling of soft tissue. There's your plantar fascia and there's your plantaris muscles. And these over time tend to weaken and flatten out, and they no longer create that sling-like, spring-like bounce as you walk down the street to make the bridge of your bones move in the kinetic chain relative to the ankle, to the knee, to the hip, and so on. So there's various reasons why the arch will go weak. One of them is age. As we age, the ligaments just tend to go looser, and that's just a known fact. So we can prevent that loosening by actually exercising them and strengthening them through our aging process. Some people are actually born with a congenital dropped arch. You can hear it called a flat foot, a dropped arch, a weak arch, a failed arch. And some people just have a predisposition in their genetics for that. The arch exercises can still help those people to some degree, or at least prevent any further breakdown as that person ages. That's where the passive supports are really important for those people, though, the arch supports. But mainly, the biggest reason that I look at that's within our control is wearing shoes. So shoes are like wearing braces on our feet or wearing a cast on our feet. And most of us have to wear shoes all day, most of the time. And we know that if you wear a cast, say on a broken arm, that within days and weeks, you start to atrophy. Your muscles become weaker and smaller on a cellular level. and even notably, if you measure the circumference, smaller. So we're wearing these casts on our feet all day, and we can't expect our arches to be strong anymore if we're doing that. So the exercise we'll be going over with you today is going to help you counter that effect of this just weakening atrophy and allow that whole kinetic chain, that slide and glide on a strong mechanical level, be as best as you can possibly be. In my office, I recommend Superfeet Insoles. These are over-the-counters. They're relatively inexpensive. They're under $40 for the full length and under $20 for the three-quarter length. The reason why I like these and why I recommend them, not only because of their ease and convenience of purchasing and their cost effectiveness, but because they have two important features. They have both of them. They have the arch support, of course, because you're buying them to be insoles, arch supports, but they have the heel cup. And the heel cup is most needed. I would not recommend ever buying an arch support unless it has a heel cup, unless you have a special need not to. And the reason why is the calcaneus bone, which is our heel, tends to go into this pronation or a slump when we have a weak arch. This keeps the heel tracking in its track so that it doesn't move in an arc of motion that's going to put strain in your Achilles, put strain in your plantar fascia tendon, leading to these different conditions that people can have a long time healing from. So there are the three-quarters for your dress shoes. That leaves the toe box open, so it doesn't fill out your space. If you use the full-length one, there's various colors. There's the green for somebody with a fuller arch already has a higher arch and a wider heel. There's the blue for someone who needs a little flatter arch because they can't tolerate the higher arch. There's black, which is flatter yet. There's many other colors available. So I recommend these. They even have them for high heel shoes, and they're great for all kinds of uses. So as far as our active support, our active arch exercise, I have a very simple exercise that I've devised. I've seen other arch exercises taught, and I just don't think they are as good as this one. So let me teach you this one today. By the way, let's do this together, but if you feel that there's any reason that you shouldn't be doing this exercise, either you have a balance problem, a lightheadedness problem, if you have severe pain or instability, any issue that makes you feel precarious or that this exercise is a risk, please don't do it. Consult your healthcare practitioner or your exercise expert and make sure you exercise safely. But for the average person, you stand with your feet easily apart, shoulder width apart, or just easily as you would, and you imagine that you're standing on two large jars. I call them a pickle jar, a mayonnaise jar. Don't actually go get a jar and stand on them, please don't. Imagine that you're standing on two large jars, and then you want to do an isometric exercise, meaning action with no motion. So you're not going to see anything happening. But what you do is you imagine that you're clenching the top of the jar as though you're going to begin to twist with your feet. But first you clench. So as you begin this exercise, just make sure that you feel equally weighted from the front of your feet to the back of your feet, and that you're standing right in the middle. Also that you're feeling equally weighted from right to left, and that you're balanced symmetrically. And then what you do is you employ the squeeze action. I don't want to see any motion happening in your feet. I don't want to see you balling up your feet and trying to really squeeze that pickle jar, other than the isometric that I spoke of. Isometric, again, meaning action but no motion. Action against resistance. So I'm squeezing right now. That's about all the motion I would want to see. The next thing is, as you're going to bring your heels together and your toes out. I'm doing it right now. Again, you don't see much happening at all, but I'm efforting my heels together and my toes apart from one another. If I let it all go completely, that's what it would look like. I'm going to squeeze my pickle jars again, bring my heels in together, my toes out, and I hold it for about 5 seconds. The amount of effort you put can vary person to person. You want to go short of hurting your knees. If it makes your knees feel pinched, which it can in some people, or it just doesn't feel right, then you just do it less firmly. Go into your release. Now we're going to go the opposite way. So first I clench my pickle jars, now I go heels out, toes towards one another, or balls of feet towards one another. That's the next one in the series. And you hold that for about 5 seconds, and then you let it go. Again, I'm not seeing all this effort and in motion. I'm seeing effort without any motion, or I'm not even seeing anything if you're doing it correctly. Okay, so now that we've got all those details down, let's just run through the exercise one time together. So you're standing upright, your legs are easily apart, and you begin your isometric clench. Clenching, twist, efforting your heels towards one another, your toes out. 2, 3, 4, 5. And then release. And then clench again. Now you're going to put your heels out and your toes towards one another, holding 2, 3, 4, 5, and then release. Then you're going to clench again, and you're going to put your heels towards one another, your toes out, holding 2, 3, 4, 5. And we'll do one more. We have released. Now we're going to clench again. We're going to put the heels out, the toes in, holding 2, 3, 4, 5. And again, just repeating this sequence up to about 3 minutes a day, or about 3 minutes a day. All right, so now that you know how to do these arch exercises, you're going to have improved support of your structures of your feet themselves. You will have less of this compensation that can happen in the muscle system with tension that runs up the sides of the leg, especially the sides of the shin, and tension that can run up the back along the Achilles as well. You're going to reduce that potentiality and allow the rest of your joints to be as free as they possibly can without having to compensate on this arch. So go forth and take this exercise into the world, get better and better, and we'll see you here on the next video.